A lot of people are taking supplements, but very few are taking the right ones for their body. I'm Dr. Jake Schmutz, a naturopathic medical doctor and integrative oncologist. Let's break down how these supplements are used in a personalized, targeted way. Do supplements actually play a role in treating colorectal cancer? Yeah, so supplements definitely do play a role in helping patients that have colon cancer. They're doing a lot of different things. They help decrease certain growth mechanisms like VAG and EGF receptor sites and all these different ways that the cancer likes to grow. There are various supplements that I use to treat colorectal cancer, and I use a lot of different ones. So a first one that I would like to start with is a very common one that probably a lot of you have heard about, and that is curcumin. So curcumin comes from turmeric. It's the active part of turmeric. It's what has a lot of the science and research on it that has the anti-inflammatory effect and the anti-cancer effect. Next treatment that I want to talk about is quercetin. One of my favorite treatments to go and kill cancer all around because it works on several different cancers, but it is very effective on treating colon cancer. Next one I like to talk about is my beloved milk thistle. A lot of us know this for how good it is for the liver. So it is really good on healing and regenerating the liver. So great to use when you're doing chemotherapy, radiation, because that likes chemotherapy and radiation trash the liver, so it helps heal the liver and regenerates it. You just don't want to take it willy-nilly. Go to a doctor that knows what they're doing there if you're taking conventional treatments. Next one that I want to talk about is called EGCG. And I like to combine this with vitamin E because we do high doses of it. But you take vitamin E, it doesn't have any toxic components to it at all. But EGCG is an extract from green tea. So we take out the anti-cancer part of green tea. So we leave out the caffeine or other constituents that are along with the green tea. And we just take out that anti-cancer part, the EGCG. A generic supplement plan is never enough because you need to give specific treatments for individual cancers. But you can't just use these. You need to use other different therapeutics to have the best effect. You need to make sure you get a good plan from a doctor that knows what they're talking about, especially when we're dealing with cancer. You just don't want to be taking something you think is going to work, and it's not working because you're not taking the right product or you're not taking the milligram dosing right. So how I approach prescribing supplements for my patients is it involves a great deal of research and also clinical experience and talking to other physicians around the globe. Some top treatments that I do for colon cancer besides just supplements, which are great, I like to do more of a plant-based vegan diet. It is variable cancer to cancer, but colorectal cancer is firm. I do a lot of IV therapies in my office to go after colon cancer. High-dose IVC is a very important one. IV artemisinin. So a lot of different therapies, and we're talking details on another episode about these individual therapies, but these are some great therapies that are in addition to the supplements that I prescribe for my colorectal cancer patients. If you want a personalized supplement plan based on your body, not guesswork, book a consultation and we'll map it out for you.